I'd like to welcome everyone to the Town of Lexington Council meeting. This meeting is being held at Town Hall Monday evening, July 6th, 2020. This meeting is being broadcast live and will be replayed several times over the next week on the town's cable information channel 1301 and will also be available for viewing on the town's website. I'm Steve McDougall, the mayor of Lexington. This time I'd like to introduce my fellow council members. In front of me to my left is Mayor Pro Tem Hazel Livingston.
Good evening.
To my left is Councilmember Todd Carnes.
Good evening.
To his left is Councilmember Steve Baker.
Good evening.
In front of me at the right is Councilmember Kathy Maness.
Good evening.
And to my right is Councilmember Todd Lyle.
Good evening.
At this time, I would like to ask Councilmember Baker to lead us in invocation for tonight's meeting. Mr. Baker.
Thank you, Mr. Mayor. Lord God, we just thank you for the opportunity to be here this evening. We thank you for all the ways that you are good. Thank you for Jesus. We pray for your wisdom as we do the business of the town. And Lord God, I also just pray the verse Ephesians 4:3 that we're all eager to maintain the unity of the Spirit in the bond of peace. Lord God, I pray for just a spirit of unity in our community, and we thank you for everything that you do for us. In your name we pray, amen.
Amen.
Thank you, Mr. Baker. This time, if you would, please stand and join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you very much. I will call the meeting to order and report on our executive session this evening. In executive session, we discussed two legal issues, one regarding pending litigation and one was advice regarding agenda items. We had 4 contractual issues. One was a downtown development issue. We had an issue regarding accommodations tax. We had an issue regarding a utility building, and we had the loan program under contractual. Lastly, we had one personnel item. It was boards and commissions. There was no vote taken in executive session this evening except to adjourn executive session. Do I have a motion to ratify the mayor's executive session report?
So moved.
Ms. Maness makes a motion. Mr. Lyle seconds that motion. All those in favor, please raise your right hand. That is unanimous. Deletions on the agenda. Are there any deletions on tonight's agenda? Anybody? And there's not a whole lot on it, so I would think not. But any deletions on the agenda? Very good. Hearing none, we will move right into approval of minutes. Copies of the minutes from the council work session and the council meeting on June 15, 2020 were provided to you in your packets. Are there any omissions, additions, or corrections? Work session June 15 and council meeting June 15. Hearing none, do I have a motion to approve those minutes?
So moved.
Mr. Lyle makes a motion. Is there a second?
Second.
Mr. Baker seconds the motion. All those in favor, please raise your right hand. That is unanimous. At this time, I'll move into a vision update, our vision plan update for July. The Ice House Amphitheater construction is underway for the Ice House Amphitheater Pavilion along South Church Street. Currently, they are in the process of digging the footings for that facility. The pavilion will be a brick open-air building with overhead fans and outdoor heaters. The goal for it is to be completed later this year. Following the completion of the pavilion, there will be a women's restroom upgrade and air conditioning added to the current facility. Due to the COVID-19 restrictions, concerts have not yet resumed. However, the market at the Ice House will be this Saturday from 9 a.m. to noon and each Saturday through the end of September. Gibson Pond Park is now closed to the public as construction crews mobilize to begin work reconstructing the dam that was destroyed in the 2015 floods. The dam will feature 2 docks and a walking pier. It is expected to take just under a year to complete. Please visit our website for a list of other parks to visit while this construction is underway. The vision plan goal, these projects and more are a result of the town's vision plan, which was reviewed and updated last summer. You can read the entire vision plan on the town's webpage. Please share your thoughts with us if you have any ideas that will improve the quality of life for our community. That is the vision plan update for July 2020. This time we will have a traffic update from Mayor Pro Tem.
Thank you, Mr. Mayor. We appreciate everyone's patience while emergency repairs to the bridge on Gibson Road near South Church Street were made. A special thanks to the SCDOT maintenance crews that corrected the issues last week. Columbia Avenue 378 between Reed Avenue and Old Chapin Road, the development of Andy's Car Wash has begun. This work requires some intermittent lane shifts and possible closures as construction of a raised median is completed. The next traffic committee meeting has not yet been rescheduled due to the impacts of the COVID-19. So with that, we're asking that if you're aware of a traffic signal issue, unsafe roadway situation, or a pothole that needs repair, please call 358-7273 and let the town know.
Very good, Mayor Pro Tem. Thank you very much. There are no public hearings tonight, but I do see a special guest in the audience. I think the Mayor Pro Tem would like to introduce.
Yes, sir. I know we've got the new business coming up of the mask ordinance for us, and how I've been doing my research is through our local officials here, talking to our local doctors, talking to our hospital, talking to our coroner, and before I introduce the person that I've asked to come and give us a little update on what's going on here, because I know all of us are a little confused because you see so much on the media, especially social media, of what's here and what's there, and everything contradicts itself. So I went straight to our local sources to find out. But with that being said, I do want to say that we have lost 10 citizens inside the town limits to COVID-19. And that hit me pretty strong, that just inside the town limits. And I verified that factually through our local coroner. And I also talked with Todd Osberger today, the president and CEO of the hospital. I felt like who better to come give us some facts and some data and to tell us why we should do the mask ordinance. So at this time, if it's okay with you, Mr. Mayor, I'd like to ask him to come forward. And
Absolutely. Welcome. Mr. Osberger, thank you for being with us.
Well, thank you all very much. I appreciate the opportunity to come talk to you tonight. And thank you, Mayor Pro Tem, for letting me come speak. I want to thank you and congratulate you first and foremost for taking a leadership role in the Midlands and stepping up and helping encourage our staff and our citizens across the county and the town to wear masks. It is terribly important, and I want to thank you for doing so. I want to thank you on behalf of the people I represent at the hospital. That's our nurses and doctors who are on the front line right now doing their very best to keep our citizens alive. And they are working hard. They are heroes, but they need your help. Those doctors and nurses are willingly caring for our community members, but we as citizens can do more to help them by bat down this disease and keep it so they have less people to take care of. And as you've seen, if you've been watching the news and paying attention, our statistics are quite scary and going up quite dramatically. I won't spend a lot of time talking about those. You've seen a lot of them nationally and even statewide, but let me tell you what we're seeing at the hospital and particularly what we're seeing here in Lexington. Since this began 17 weeks ago, and I remember the day we first diagnosed our first case was March 7th. In 17 weeks, Lexington County has diagnosed 2,445 positive patients. But 882 of those have been in the last 2 weeks alone. We've seen a 56% increase in the positive cases in the last 2 weeks alone. In the zip code I live in, just outside the town, 29072 here in Lexington, we've diagnosed 467 people since this began, 17 weeks ago, but 144 of them in the last 2 weeks, a 45% increase. At the hospital, we care for everyone who comes to our doors across the Midlands, not just folks in Lexington County. but we've diagnosed almost 1,500 patients positive since we started, again, 17 weeks ago. 615 in the last 2 weeks, a 70% increase in the last 2 weeks alone. Now, positive cases are one thing, and there is a significant delay from what we've seen of anywhere from 2 to 4 weeks from when people get diagnosed or start showing symptoms to when they come into the hospital, and heaven forbid when they pass. So I think what we're seeing in front of us is a coming wave of more hospitalizations and deaths. But just put it in perspective, we've seen that wave begin already in the last week. A month ago, June 7th, we had 23 patients in the hospital who were positive with COVID in either the ICU or our dedicated COVID medical unit. Today, we have 64. We have 80 beds dedicated right now to manage that population. And again, none of us expected to see 64 patients here already in such a dramatic increase. As I've mentioned, the volume will continue to rise, we expect, of hospitalizations. And that scares us. It's not just the positive cases. It's those that get admitted to the hospital and either stretch our hospital caregivers too far or prevent other needed care from occurring. Because while we're focused on COVID, heart attacks aren't going down, cancer's not going down, strokes aren't going down. We're still having to provide care to the folks who need us every day, but we're trying to balance both. What we're seeing on our population of folks we've tested is while it is a severe illness for those who are senior citizens or have significant comorbidities, we are still seeing younger people have a difficult time with this illness and be hospitalized. Just a few statistics, and I'll stop sharing numbers, but if you're under 50 and you get diagnosed with COVID by Lexington Medical Center, 20% of those population is being admitted to the hospital. If you're over 60, between 60 and 69, 40% of our positives are being admitted. And again, if you're over 70, almost 50% of the people who are diagnosed are being admitted to the hospital. Thankfully, we aren't seeing the mortality that you've seen in other large metro areas prior to this. Our mortality rate in South Carolina, as you saw, is now roughly about 2%. That's very good. But that was mostly before we saw this big wave of additional positives. I can't predict what mortality will be. I think any mortality is too much. But I'm asking for help across the community, helping try to stamp down the illness so that we have the caregivers who can provide care when, in fact, somebody becomes ill. As many of you know, I'm a past chairman of the Lexington Chamber of Commerce and still very active in that organization. And I'm passionate about us getting back to work and opening our small businesses in this community as well. Lexington Medical Center only works in Lexington in the Midlands. We're integral to this community, and we care about our friends and neighbors getting back to work. But I don't think it's a choice of either masking and trying to stop this illness or getting back to work. I think we can do both, and I think we should do both. So one of the things that I want to emphasize is I don't think it's too much to ask for our citizens to put a mask on to help protect you from what I might be carrying. Because that's one of the odd things we've seen with this illness as well. There are so many people who are asymptomatic and don't know they're ill. With the flu, most people have symptoms, know they're sick, they stay home, they keep it from spreading to someone else. With this illness, it's so odd, most people don't know, particularly younger folks, know that they're ill. And if they don't know, and they talk and they cough or they sneeze or they just yell real loud or they sing, their droplets reach as far as the mayor is. And if you're in those droplets, whether you are young or not, you have a chance of acquiring that disease. By wearing a simple mask, if I cough, if I sneeze, if I do something else, that spray stays relatively close to me. And what that does is it protects Todd or it protects Steve. And if you're an asymptomatic carrier and you take it home and you spread it to your father, heaven forbid, I'll be, frankly, complicit in helping your father get very sick. And I don't want to do that. I want to help protect our friends and neighbors as best I can, even people I don't know, and your family from getting sick. So if we all would do this, this has a dramatic effect on reducing this illness. Dramatic. And I truly believe if the majority of us wore masks, we would see those numbers rapidly begin to come down. Will it kill it forever? I'm not your epidemiologist. I'm clearly not Dr. Fauci. But I know it will help greatly. And I don't think it's too much to ask for our citizens to have a minor inconvenience on front of them for the amount of health and wellness and saving it will do of people's lives. Again, I think we can open our businesses. The sooner we get this illness behind us, the better we can all get back out in our community and have the thriving community that we're all proud of. But we all have to do our part. And your leadership telling folks about the importance of this, and to be frank, requiring them to do that when they're out, like me, at Lowe's or Publix or anywhere else, I think will have a tremendous impact in our community and will help us and our caregivers be better prepared to take care of their friends and neighbors. So I applaud you for trying. I appreciate your leadership, and I'll help you any way I can.
Todd, thank you very much. Appreciate you being here and appreciate your information that you shared with us tonight. Hazel, thank you for asking him to come be here tonight and share that information. Anybody have any questions for Mr. Allsberger? Very good. Todd, thank you so much.
Thank you all very, very
It's
much.
great to see you.
Thank you so much.
There is no old business tonight, so we will move right into new business. Our first item of new business is from Councilmember Kathy Manis, ratification of the emergency ordinance number 6, requesting individuals to wear face coverings in public areas in the town of Lexington and expansion of the utility rebate program. Ms. Manis.
Thank you, Mr. Mayor and Council. Emergency Ordinance Number 6 established requirements for face coverings in retail establishments open to the public and authorized the town administrator to expand and continue the water and sewer rebate program. Emergency ordinances under state law require one reading, are valid for up to 60 days, and require a 2/3 vote of council. On July 2nd, 2020, an email poll of council elicited a 2/3 majority vote to approve an emergency ordinance. A copy of the approved emergency ordinance is attached. Mr. Mayor, I make a motion to ratify the email poll vote.
Ms. Manis makes a motion. Is there a second? Mr. Baker seconds the motion. Any further discussion?
Yes, sir, Mr. Mayor.
Yes, sir. Mr. Carnes.
Yes, sir. I wanted to address a few things in this, and I hate that Todd stepped out because Todd, as the leader of Lexington Medical Center, knows infinitely more about these kinds of things than most. But it has been somewhat of a divisive issue. It's an issue that's dividing people across the country, certainly dividing people in our community. I'm getting Facebook messages about people saying, I ran into the Circle K and people are not wearing masks, and do I call the police? Where do I call for enforcement? And so it's easy for this type of issue to become somewhat divisive, and I think these issues where the government kind of uses its infinite power are issues that need to be thoroughly debated and thought through, and we need to try to do the best thing for everybody. I don't think there's anybody that sits on this council that would want to endanger anybody, to cause any type of harm to anyone. But as one who doesn't want to cause any of that harm, I certainly want to express my reticence to use our infinite power to demand this of our citizens. I feel like when we pass laws that really have no enforcement mechanism, maybe we're just teaching people not to obey the law. I think there was a time we thought about an encouragement, but I just think that the science on this is far from settled. I wore a mask this morning. Sometimes I wear them. One of the problems with me wearing a mask, I don't know about you, Ms. Manis, but it causes my glasses to fog. I see, Hazel's got hers down her nose. It causes mine to fog up because the vast majority of everything I breathe comes right out of the top of my mask and into my glasses. And so the science on this is just far from settled in everything that I've done. And the other thing that causes me pause is just the fact that as a town council, like, we've had no insight from DHEC other than what we get off the internet, no special knowledge, special privilege, and the things I read tell me. I even read something from the World Health Organization just a little while ago where they said that the transmission of COVID from an asymptomatic individual to others is somewhere between very rare and non-existent. And so I just want to say that I understand all my council members have everybody's best interest at heart, but I'm not convinced that the science is there based on the studies. Everything I read says it may help, it might help, and this is from the CDC. And if I could, just one more moment, Mr. Mayor, read a few things that I pulled off of those sites that I shared with council. And the Center for Disease Control released recommendations and said these measures, while these measures may be optional, they may help reduce the spread of the virus. The one thing we do know helps is social distancing and washing hands. The other thing the CDC said about wearing masks is kind of problematic is they say you should change your mask every day. You should not touch the front of your mask. You should be careful about how you take it off, only touching the ears. Every time you take it off, you should wash your hands. And my question is for people that run around our town that are in businesses and they're going to run in the quick shop and they got to put it on and take it off, and they're running Lowe's and they got to put it on and take it off, they're destroying anything that it might have done, and they're outside of CDC guidelines. And so I think it's impossible to wear a surgical mask out in public when you're hustling, working, trying to get things done, the way you wear one in an operating room where you have a total sterile environment. You kind of put it on one time, you don't touch it, and if you do touch it, there's somebody there to put a new one on. And so I'm not questioning motives, but I think until the science is clear that we should not mandate things like that. I think if it was ultimately clear, I think there would be unanimity. And the last thing I'll say, and then I think there's a gentleman here, Mr. Doug, who might give us a little insight into the mask issue, is on May 21st, the New England Journal of Medicine wrote the following when they did a study about whether or not masking should be universal in the hospital, not in the public, but in the hospital. And 5 MDs who are infectious disease experts said, we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. Those are not casual passing in the Circle K or even casual passing in Lowe's and some of our supermarkets, the way they've changed the aisle structure and done a really great job at working at social distancing so that people aren't forced into tight environments where they would sustain 10 minutes of face-to-face contact less than 6 feet. In many cases, the desire for widespread masking is a reflexive reaction. And so there is a lot of debate about this, but certainly there's no consensus. And so with that, I feel like it's premature for us to make that kind of dictate to 50,000 people who may shop here. I also feel that this kind of decision shouldn't be made by town councils because we're just a small town. If some kind of decisions like this can be made, it should be made by health officials at DHEC who are having one-on-one conversations with people at CDC and have some real insight into infectious disease control, which none of us have. That's all I have, Mr. Mayor.
Thank you, Mr. Carnes. Anyone else have anything they'd like to add?
Mr. Mayor, if I-
Yes, sir, Mr. Lyle.
And I'll also address some of this and certainly won't elaborate as much as Mr. Carnes did, and I would join in most everything he said and would further point out that I appreciate everybody's position in the room. I appreciate that we have civil discourse and we can agree to disagree. I certainly don't want that to be taken as or looked at in any way, shape, or form as being unsafe or dangerous, or if I'm obviously asked to be less than 6 feet from you or in an enclosed space for a long period of time, then I'll certainly do that out of respect and wear a mask. But some of the things that I want to point out are, as Todd already alluded to somewhat, when you arbitrarily enforce a certain rule. Similar to a military leader I had years ago who said anytime you don't correct someone who misses the standard, you lower the standard to whatever it is that wasn't corrected. And so I took a gander at a couple places around town this weekend, and there are a lot of folks invoking these exemptions. And so what I want to point out, in the issue, one of the issues that I have is a law or an ordinance without an enforcement mechanism is not really a law or an ordinance. It's merely no different than what we did earlier, which is a proclamation or a resolution to encourage the public to be responsible. And I'll stand here today and say that that's exactly what I want to do. I want to encourage social distancing, encourage good hygiene, encourage, all the things that can help prevent the spread of this. What I don't want to do is encourage something that we call a rule that we wrap in the shroud of just simply being a resolution, because there's no enforcement mechanism. You can look someone right in the eye and say, I'm not wearing a mask, not because of your rule, but because I don't want to. And the way this thing is written, it essentially gives you 7 different exemptions, which is pretty easy to follow through. Moreover, it's no different than a speeding sign, speed limit through town, where you don't have the power to write a blue ticket. It merely becomes a suggestion. And then what polices that is the free market. It's the Autobahn of Europe, where people die because they drive too fast, so they slow down. And so I think from what I've seen, I'd like to see a different approach and not simply wrap, again, a false sense of security out and call it an ordinance when in fact it's really not, because it doesn't have an enforcement mechanism. It doesn't have what I think to be a narrowly tailored set of exemptions. You have an exemption that says if you're in private or individual offices, it says if you're outdoor or unenclosed areas in which social distancing of at least 6 feet is possible and observed. I also think it's important to say that you could, to some degree, shape, or form, be giving people a false sense of security. It's a simple way of saying, hey, I am being safe. I got a mask on. But as Councilmember Carnes just pointed out, what if it's the mask you stuck in your pocket that you wore yesterday and the day before, and the same mask you wore when you went in a place that was dangerous or not practicing good hygiene? So I don't think it's as, and I appreciate and respect Mr. Osberg. I think to characterize what he called a minor inconvenience is unfortunate, because it's not a false dichotomy. Because I don't necessarily think a mask is worn right now, that does not mean that I don't want a minor inconvenience, and I would much rather be unsafe around others. I would much rather spend my time and my energy saying that we should be responsible, we should practice good hygiene. This is a serious issue, and it needs to be treated serious, and I'm concerned that efforts being focused towards that way are not really putting to light what really should be focused on. I think we're focusing our efforts in an inefficient and unsuccessful area. With that, I appreciate your time.
Very good, thank you. Anyone else have anything they'd like to add?
Mr. Mayor, may I add one more thing?
Yes, sir.
I do think that, obviously this ordinance has the support of 2/3 of council as required, but I do think it's important to try to delineate at what point would we remove this ordinance? Is there some marker or some thing that we pass where we would pull this back? I know it expires at the end of 60 days, but what would actually trigger pulling it back is one question I have. And then at this time this time wouldn't be the appropriate time to take public comment, would it, Mr. Mayor?
No, sir.
That's all I got.
Very good, thank you. Anyone else have anything they'd like to add?
I'd just like to say
Yes,
one
Ms.
thing.
Manus.
So I don't know if y'all watch the governor, but I watch the governor when he has his press conferences. And Dr. Linda Bell from DHEC, every time she gets up and speaks, she says, wear a mask, wear a mask, wear a mask. So from the head doctor at DHEC, they are saying wear a mask. So I think that's important. And also, updated June the 28th, the Center for Disease Control, now, in the past, they did not recommend that people wear masks, but now they are recommends that people wear masks, cloth face coverings in public settings, and when around people who don't live in your household, especially when other social distancing measures are difficult to maintain. The cloth face coverings may help prevent people who have the COVID-19 from spreading the virus to others. And like I said before, they did not say wear a mask, but updated June 28th, 2020, the CDC is recommending that people wear cloth face coverings in public settings. Thank you, Mr. Mayor.
Yes, thank you, Ms. Manus. Anyone else? I'll share something with you that, and I respect both of your comments, but I'll share something with you about masks and how well they do work. My wife works in the emergency room at Lexington Medical Center. She's been there every weekend since COVID started, wears the same mask her entire 12-hour shift, and it has protected her from the COVID-19 disease. So it works. It obviously works. Our healthcare providers are staying safe. So we can say what we want to about not wearing masks and taking personal privilege away. I'm sure we were saying the same thing when they passed the seatbelt law. Didn't want to wear a seatbelt, but how many lives have we saved wearing seatbelts? Listen, we are the 5th highest COVID positive cases in the state and number 5 for COVID positive deaths in the state. If there's something we can do to make sure that we drop out of the top 5, I'd like to do that. And this is a very, very easy way for us to do our part in fighting this disease. And I appreciate everyone's efforts in doing this. It's the right thing to do to protect our community and the vulnerable in our community. You heard about the morbidity issues that we have throughout our community. Those people deserve an opportunity to go to the grocery store and not have to fear getting COVID-19. They should be able to go to the pharmacy and not have to fear COVID-19. And if we can help them in that, I think that's something that we definitely should step up and do. Thank you. Anyone else?
Mr. Mayor?
Yes, sir, Mr. Baker.
So the other day, I polled 3 of our neighborhoods inside the page on Facebook. Just a simple question. Would you either oppose a mask requirement or would you support a mask requirement? In these 3 neighborhoods, I had 40 people who voted on my poll that they would be opposed. I had 203 who voted they would support a requirement. And just breaking down the percentages, looking at around 16.5% opposed and 83.5% in support. And so in regards to just how our citizens feel, I mean, I kind of took that as taking the temperature of our folks, and I was actually very impressed, just surprised at the results of that. And so just wanted to bring that up as well. 243 votes, 203 of them were for a requirement. So that's it. Thank you, Mr. Mayor.
Mr. Mayor, I have a question.
Thank you, Mr. Baker. Yes, Ms. Manus.
Mr. Baker, which neighborhoods did you do that with?
Wellesley, Settlers Point, and Cherokee Village.
Thank you, Mr. Baker. And thank you for doing that.
Very good. Anyone else?
Yes, sir, Mr. Mayor.
Yes, Mr. Carnes.
Just as the final thing, I would just like to address that, again, there's 7 of us, and everybody wants what's best for our community. Everybody wants what's best for our vulnerable populations. But again, just going back to the mask issue and the comments about people deserve to go to the grocery store and be safe, and they deserve to go to the pharmacy and be safe. And certainly, in an ideal scenario, we would love for that to be the case. However, I'm an engineer and I'm a guy by science. And science says that the only way you can be safe is through social distancing and not being around people who have COVID-19. And therefore, we have drive-through pharmacies and we have pickup groceries. And so what I don't want to do is I don't want to communicate to a 60-year-old who has other immune suppressing issues that now that everybody in CVS or Lowe's has on a mask, this is now a safe place for you to go. That is a false message and a very dangerous message, because the fact that everybody there has on a mask because City Council passed an ordinance making them wear a mask does not make it a safe place to go. Every scientific study that you can find says when you cough, COVID-19 goes through this mask. It goes on the outside, it goes through the top, it goes through the bottom. And so all of the things that would infect others, there is no mask that would contain that other than potentially an N95, and people aren't wearing those. And so I think it's a better message to send to those people in our vulnerable populations that we want to save. Please, by all means, use grocery pickup. Please go through drive-thrus, because if there are 30 people in CVS and they all have a mask on, it's not safe. That is not a safe place for you to go, because if 10 of them have COVID, there's a lot of COVID in the air. That's my position, and again, everybody wants what's best for everybody, but that's what the science says. And we need to follow the science, because as a government, again, we have infinite power to dictate these things, and we should dictate them when absolutely necessary. But when the science is unclear, we should not dictate them, in my opinion. Thank you, Mr. Mayor.
Very good, thank you.
Mr.
Yes,
Mayor,
Ms. Livingston.
I respect Mr. Carnes' thoughts and his comments on all of his research and everything he's done, but again, I refer back to talking to our professionals here in this area, including doctors that have worked on the COVID floor and how strongly they feel about it, that are citizens in this town. And also, like Ms. Manus said about Linda Bell, she stresses that every time. And if there's not something to it, why would our local people be begging us to do this? So there's got to be something to wearing a mask. I don't see Miss Bell, she seems to be a very serious woman, standing up there just saying wear a mask just to wear a mask. I don't see her doing that. She obviously knows something. I don't see Mr. Osberger, who's the president and CEO of our hospital, who's begging you to help them by wearing a mask, coming to this meeting and asking us just to be doing it. There is hesitant and there's guessing all over the place with this, and it's changing day by day. But if we can do this, and our leaders in this town or in this county is asking us to help them, we should, including doctors that are working on the COVID floors. If they feel that strongly, there's got to be something to it. So I just feel like that we should be listening to our local people.
Thank you, Mayor Pro Tem. One last thing, there is a penalty and there is a enforcement mechanism for all of our ordinances in the town of Lexington, and an egregious violation of one of our ordinances is absolutely a penalty of up to $500 and 30 days in jail. So there is an enforcement arm for our ordinance.
Mr. Mayor, may I?
One last time, Mr. Carnes.
Just to address that, just for clarity, are we saying as a council we have authorized our enforcement officers to issue $500 fines and 30 days in prison for not conforming to this ordinance? Because I haven't heard that before, and I just want some clarity on that, because that feels like a big statement.
Yes, for egregious violations of the mask ordinance, there is a provision in our code that allows for those penalties. Very good. We had a motion and a second. All those in favor, please say aye, or raise your hand, rather. Please raise your hand. All those opposed? Ayes have it. Thank you. Item number 2 of new business is the social media policy. Councilmember Todd Carnes.
Sir, 1 minute, Mr. Mayor. The town of Lexington has multiple social media accounts to further connect with citizens and the community as a whole. In order to promote effective communication and maintain a respectful dialogue in the social sphere, commenting and moderation rules are needed to maintain a productive and open forum for community discussion. Truer words have never been spoken. The proposed social media policy is attached Mr. Mayor, I make a motion for council approval of the social media policy.
Mr. Carnes makes a motion. Is there a second? Second. Mr. Baker seconds the motion. Any further discussion? Hearing none, all those in favor, please raise your right hand. That is unanimous. Our next item of new business is reappointments and boards and commissions. Councilmember Steve Baker.
Thank you, Mr. Mayor and Council. The terms for the following boards and commissions members expired June 30, 2020. Reappointments require approval by council. Advisory Committee, Jenny Kurtz and Robert Suggs. Building Codes Board of Appeals, James Snell. Historic Preservation Board, Mandy Derrick. Planning Commission, Brian Amick, Roscoe Kaufman, and Sammy Hendricks. Traffic Committee, Jennifer Morgan. Current boards and commissions vacancies, we have 1 vacancy on the Advisory Committee, 2 vacancies on the Board of Zoning Appeals, 2 vacancies on Building Code Board of Appeals, 1 vacancy on Historic Preservation, and 2 resident vacancies on the Traffic Committee. I make a motion for council approval of reappointments.
Councilmember Baker makes a motion. Do I have a second?
Second.
Mayor Pro Tem seconds the motion. Any further discussion? Hearing none, all those in favor, please raise your right hand. That is unanimous. Our next item of new business is number 4, Councilmember Todd Lyle, Cherry Ridge Subdivision Drainage Improvements. Mr. Lyle.
Thank you, Mr. Mayor. Cherry Ridge Development sits downstream of the Palmetto Courtyards neighborhood along Powell Road and experiences significant erosion impacts from high-volume rain events. In 2018, the town evaluated possible alternatives and provided minor mitigation measures in select areas. Minor mitigation efforts will not meet the high demand of this drainage area, which requires development and construction of stormwater management feature to provide some relief. Recently, the town received a design fee proposal in the amount of $26,650 from Cross Engineering to survey, engineer, and permit a stormwater feature upstream of the affected area. Mr. Mayor, I make a motion for council approval to fund this project through the Roads and Infrastructure's budget.
Mr. Lyle makes a motion. Is there a second?
I'll second it.
Ms. Manus seconds the motion. Any further discussion? Hearing none, all those in favor, please raise your right hand. Our next item of new business, item number 5, Circle View Drive Drainage Repair. Mayor Pro Tem.
Thank you, Mr. Mayor. Significant rainfalls combined with the existing storm drain deficiencies on Circle View Drive has caused a severe washout behind a storm drain box and curb. The scope of this work is complex due to elevations and utilities, so the assistance of a bonded contractor was requested. 3 quotes yielded a low cost of $19,700 from Martin & Son Contracting for restoring the area and installing new curb to prevent future failures. I make a motion for council approval to fund this project through the Roads and Infrastructure budget.
Mayor Pro Tem makes a motion. Is there a second?
I'll second it.
Ms. Manus seconds the motion. Any further discussion? Hearing none, all those in favor, please raise your right hand. That is unanimous. That concludes our business for this evening. This time we will hear announcements from Councilmember Todd Carnes.
Yes, sir, Mr. Mayor. We hope everyone had a fun and safe Independence Day this past weekend. Just want to give you a few reminders. The market at Ice House was closed Saturday due to the holiday, but it will be back this Saturday from 9 to 12 with over 25 vendors each Saturday. We will continue to take extra precautions to ensure your safety and to encourage social distancing. Also, if you would like to be a vendor, please email us at market@lexsc.com. The Planning Commission will meet here on July 22nd. Council will meet again on August 17th at 6 for a council work session and 6:30 for council's regular meeting. We would all like to wish the mayor and Jamie, his wife Jamie, a happy 20th anniversary this week. Congratulations to you guys. Too bad you can't get away and celebrate, but maybe pretty soon. So for everybody else, Thank you for watching Town Council tonight, and thank you for being active participants in our town as we all strive to make ourselves better.
Very good. Thank you, Mr. Carnes. Anyone else have anything they'd like to add? Very good. Any questions from the news media? Did we have anybody call in for any questions? Very good. Are there any questions from the public? Any public comments tonight about any agenda items? Rich, hey, nice to see you. We passed it. Yep. Thank you, Rich. Anyone else have anything they'd like to offer? Stuart, thanks for stepping in. Britt, we're thinking about you. I hope your daughter's going to be fine. Keep you in our thoughts and prayers. Hope that it stays away from the rest of your household. That concludes our business for this evening. Thank you for watching the Town Council meeting for the town of Lexington. This meeting was held at Town Hall on Monday evening, July 6th, 2020. A recording of this meeting will be aired on the town's information cable channel 1301 several times during this week, and a video will be available on the town's website at lexsc.com. Without objection, we are adjourned.